Today we're going to talk about natural ways to boost your immune system. Hi, I'm Dr. Angela Yeagley of Sage Health TV.
Hi, I'm Dr. Julianne Morella, naturopathic physician and acupuncturist here at Sage Integrated Medicine Clinic.
Oh, this is good. Just going to bust it out. I am also a naturopathic doctor, not an acupuncturist. So today what we want to do is just give you some tips and tools to get through the winter. We're coming up in the cold season, and some of these things we're going to talk about I'm sure you've heard about or you know of, but I think there are going to be other things that you maybe haven't considered. So today I just want to review some things that are, mostly we're reviewing kind of, how do you support your immune system? This isn't treatment specifically, like if you get sick. So we just want to make that very clear that if you get sick, you need to reach out to us. And that's with anything, any type of virus, you need to ideally get in touch with us because our dosing of how we do things and how we approach things are very individualized based on your own history and your immune system and then also your needs. So, okay, well, let's get started. Do you want to start us out?
Yeah. So when I talk about the immune system, I really like to make sure that my patients know the basics because we can talk about all these supplements and get really sexy with our plans, what I tell my patients all the time. But the thing is supplements cannot replace a very, very bad foundation. So I want to make sure that you are doing the things that you need to be doing before I add other things in, right? So the first thing is a healthy diet. So you got to cut out all the processed sugars, the fatty foods. Yes, it is super duper tempting to have fatty foods when it's cold and you just want to snuggle up and have a hot chocolate, but it's really not great for your immune system. Foods that are really helpful for your immune system is bone broth. I tell all my patients to have pho because it's very good for you. Sauerkraut, mushrooms, lots of citrus fruits that are high in vitamin C. And then the next thing that I like to focus on is sleep. So telling patients to sleep at least 8 to 9 hours a night. Sleeping is your time to rest, digest, relax, and detox. So you got to make sure that you're getting enough rest. Exercise, and I want to harp on this. So movement is key, and the way that I think about this is if you think of a swamp, right? That's still water. There is a increased risk or high probability of bacteria growing in very still water. But if you are sourcing your water from running water like a stream or a river, there's likely not going to be any bacteria in there because it's always moving. So this is the same thing with our blood and our bodies. You want to keep moving so those immune cells are traveling along the body and seeing if there's any hidden infections. And then go ahead.
Yeah. So a couple things I wanted to also say here, that you pointed out, just coming back to diet for a second, is just making sure, you mentioned healthy fats are okay. I mean, obviously you don't want to do things that are excessive, but you're looking for damaged fats. But sugar is really, wanted to put that in there, that sugar is really the immune system killer. And so if you have just a teaspoon of sugar, it will actually decrease your white cell count for 12 hours after that. So your white cells are what fight infection. So if you're getting sick or you're trying to avoid getting sick, your sugar intake really needs to come down quite a bit. So I just want to throw that in. And then coming back to stress, stress will also, basically it suppresses your immune system, and that also has kind of a longer term effect, so that cortisol spikes, and again, your body thinks, I'm running from the bear, right? And so there, really the goal is survival, not like fighting an, immediate infection. So you don't want to do that. So if you're in that constant, I gotta go, it's, that's where we start recommending, you need to do things to bring it down and feel calm and have times of relaxation and deep breathing.
And a little bit of cortisol is okay. Exercise is going to increase your cortisol, but it's that balance, right? Too much cortisol actually silences the immune system, and then you can't have that immune activation you need if you do run into a virus or bacteria or whatever. Next thing, water. So I always tell my patients that we need to drink half your body weight in fluid ounces. Which I know is difficult. I mean, I'm doing a challenge right now and I drink so much water, and it's very hard to remember to drink water in between patients, and it's very annoying to go to the bathroom all day. But
it's so worth it.
It is.
How you feel.
You know, I'm actually less bloated. Like, practice what you preach. So yes, it's your way of detoxing. And peeing out all those toxins. So, and keeping your tissues hydrated.
Yeah.
And
sorry, I threw off your thing. I was thinking you were talking about water before. So, so maybe we're on gut. Maybe okay, gut. So gut again. Most a huge level of our immune system, or amount of our immune system, is in our intestines. One way we measure that is something called immunoglobulin A. And a lot of the things that we talk about, if we're giving somebody something, it actually boosts IgA. But there are things that actually can bring it down significantly. So like your food allergies or intolerances are really going to impact that immune system, or infection in the gut. So we deal a lot with that, so I would say like, bacterial overgrowth, fungal overgrowth, parasites even. So then coming back to like, what foods, what things are like, the sauerkraut is going to nourish the probiotics. It's, that healthy bacteria to heal the gut. Bone broth actually has immune components to it. Also will heal the lining of the gut, or other things as well.
Water.
Right? And water. Water for the gut. Yes. Moving that stool through so you have good transition. Anything else you'd say on that one?
I would say, I think a lot of people forget that you should have a bowel movement every single day.
Great point. Also,
yes, well-formed,
so good.
Easy to pass.
Every day.
And well-formed like a banana is what I tell patients.
Yeah, that's perfect. I had somebody tell me like, oh, I'm regular. And I'm like, what does that mean? She said, oh, every 3 weeks. I'm regular once every 3 weeks.
Oh, that's horrible.
Oh my God. Yeah, once a day. Yeah.
Yes.
So now kind of getting into supplements. So obviously you can take a lot of things. We don't recommend that you take everything on this list. This does come back to things being individualized, and where do you have kind of weak areas? Do you tend to have weak lungs that need more support? In that case, it might be vitamin A. Do you have weaker connective tissue? That might be C. Or you can do combination of things. So starting out, like vitamin C, everybody knows about vitamin C. I would say maybe a good prevention range, is like 1,000 to 3,000 a day, in divided doses. And that's, it's going to help stimulate the immune system as well as, heal your tissue.
Yeah.
Do you want to talk about D?
Yeah, and then you can talk about the study. So vitamin D is is usually low in most people here in the Pacific Northwest. Yes. And, there is a large reference range that we see in labs, but there's actually a functional range that both me and Dr. Yeagley like to see. Yeah. So vitamin D is very, very helpful in modulating the immune system and reducing a cytokine explosion and supporting the immune system.
Do you want to explain a little bit what immune modulation means? Like calming the immune system. So
I was like, you can.
Yeah.
I was like, I'm not sure.
Yeah. So what that means, why vitamin D we're finding now, especially at this time, in our pandemic lives, is so important is, so what an immune modulator is an element or a nutrient that can boost the immune system when it's needed, but also calm the immune system down when it's needed. So part of the problem we're seeing with COVID specifically is that the immune system goes nuts, goes insane. And that is part of what causes, many times a lot of the damage that's occurring in the lungs. And the rest of the symptoms in the rest of the body is that the immune system has almost an overreaction. So the cool thing, if you don't mind if I jump into the study, the cool thing is that what we're finding in the research now that there are studies coming out on this, that when you're doing high dose vitamin D, so there was a study in India called the SHADE study, and it was 50,000 IU of vitamin D3, which is active D3, for 7 days. And so what they found was actually really, really cool. So people actually had significantly less severe infections. They had less viral replication, so also less risk of, transmissibility, and less actually side effects from the immune system just being out of control. And that's where we're getting into like that reducing cytokine explosion. So cytokines are those things, if you hear that in the world, when people are talking about studies with COVID, that's the cytokines are those little chemicals in your body that are inflammatory markers that just go nuts, and that's what is unusual about COVID actually. So yeah, there we go. So the only thing here, and I just want to mention, is that the only reason, again, please don't treat yourself with the 50,000 IU. Please, come in and talk with us. Actually, what they found though, because there were like 10,000 people in the study, they had almost zero incident of negative side effect, including, essentially, it was basically extremely well tolerated. They thought that was super interesting. And so, so the likelihood you're probably fine, but we still want you to contact us. The only potential is don't doing it if you have hypercalcemia. And if you don't know what that is, you probably don't have it because it's probably diagnosed a long time ago, something like sarcoidosis, or, your parathyroid has a problem. So these things are really rare, but if you have too much calcium in your body, you do not want to do high dose vitamin D. Yeah. So we're going to talk about vitamin A.
So vitamin A helps protect the mucosa. It also helps support the immune system. And then actually, it also helps increase IgA in the gut, which then obviously will help support the immune system in the gut. So if there's any infection or any threat in the gut, you definitely have more immunoglobulins in there to help you fight those infections.
Yeah, great point. And mucosa is just that kind of like pink soft tissue that are like it's in the nose and the throat, down inside, this area. So, and in the gut. Zinc, everybody knows about, basically antiviral. It helps the immune system. I would say, good range vitamin A, we're probably looking at prevention 5 to 10,000, zinc, probably around 10 to 25, yeah. And then glutathione is amazing, always one of my favorites. Do you want to talk about it?
Yeah, so glutathione is the major antioxidant of the body. It actually helps you detox all of the environmental toxins that we are exposed to on a daily basis. It also helps you fight infections, and it's super duper supportive to the liver.
Yeah.
So you can actually take this orally, and I usually do anywhere between 50 milligrams to 500 milligrams. It really just depends on what I'm trying to do, whether it's immune boosting or mold toxicity. Yeah. So you can also get it intravenously, which is really great. And we'll talk about IV therapy, but I'll just
just talk about it. Yeah.
Okay. Well, the beauty of getting glutathione intravenously is that instead of having to take something orally, it's bypassing the gut and going straight into the bloodstream so your body can use it right away. And it's quick and it's really easy because you don't have to remember to take something every day. And some glutathione supplements, not the one that we have, taste gross. So at least if you get intravenously,
very egg-like,
you don't really get the icky taste.
Yeah, absolutely. Yeah, I would say IV glutathione is at the top of the list, like when we're coming back to supporting the brain and the immune system. Yes. And NAC is actually N-acetylcysteine. It's the precursor to glutathione. So, it is way out there. That's why there's shortages in it right now, just because everybody, I think, a lot of people have heard about NAC and they're like, oh, it's antiviral. It's an antioxidant itself. It actually thins mucus. So the lungs love it, so a strong affinity for protecting the lungs and the liver and other areas of the body. So I think that's why everybody's on the NAC wagon, which I think is good. The dose range for NAC is probably going to be I would say somewhere between 300 to 600 milligrams, but you can definitely go up from there, and it's pretty well tolerated. I know we're going probably maybe over. If you're still with us, thank you for sticking with us. Maybe just briefly, we can talk about herbs. There are a lot of antiviral herbs and immune supportive herbs. More than this, just mentioned garlic, olive leaf, and quercetin is also pretty well known right now, just because of the studies around COVID. Any others that you would think of that you like?
Elderberry, echinacea.
Definitely.
I think those are probably the big ones that you can probably even just get like little elixirs or something at any like special store, like pieces.
You're like, where would that be? Yeah, the store. Sell supplements. Yeah. Or here, we have it too.
And those are nice because they taste good. I actually like them because you can put them on like toast and like it's immune supportive, but also tastes really good.
Which one goes on toast?
Like if you put like a little, because like sometimes they have, what are they called? They're like syrups. They're like elderberry syrups.
Like the solid extracts.
Yeah,
Okay.
And you like put it on toast and have it for breakfast. It's so good.
That is true.
It's lots of carbs,
yeah, that's a good point. She's on my carb kick right now, so yeah. So IV therapy, we talked about, glutathione, but we do high dose IV vitamin C, which is pretty amazing. And, this is where, again, we really like to see people to kind of go, do you have other things that we need to be supporting in addition to your immune system that we might be putting in there? But we can do IV zinc, as well. And then times we like to support the Bs also just because they help energy production, which, your immune cells have more energy, they're going to function better. So lots of things that we can do there. And again, as Dr. Morella mentioned, that, there are a lot of people these days that have problems with their gut and gut absorption. And when we inject something and when we do IVs, we don't have to worry about that at all. It's absorbed 100%. So you're going to get this amazing therapy that your body is just going to suck right up. So we're a fan.
And the beauty is like we can do high dose vitamin C with IV therapy. So like if vitamin C, most people, well, it depends on the person, but I would say most people can probably tolerate anywhere between 2,000 to 4,000 IUs of vitamin C before they get loose stools. Well, IV therapy, like we can go all the way up to 25 of even grams or even higher.
25,000 milligrams.
And you're not going to get loose stools. So that's pretty great.
Yeah, it's pretty great. So our last is sauna. Infrared sauna, which we have here, can also really nicely support the immune system. But you also get detox, support there too. And so, if there are things maybe that you shouldn't always be doing that could suppress your immune system, really the skin is a great way just to push things out. I mean, it really helps the liver and the lymph system deal with those things. So, we love incorporating that. But again, depending on the person and what you can do. So thank you so much for joining us today. And please, if you have any questions and if you would like a plan, developed for yourself based on what you're dealing with, and your own personal, where you need support individually, we would love to do that for you. Please reach out to us. So thank you for joining us, and we will see you next time.